We are here at the meeting of the American Public Health Association. And the topic of this meeting is rebuilding trust in public health and science. So that already indicates that there is some loss of trust in science.
We're in a moment in our society where there is so much information coming from so many different sources. Absolutely. And so we really are committed to continuing to be that source of trust so that we can ensure that we're providing folks with accurate information.
In the world that we live in, there's so many inputs of information. We have to combat so much mis and disinformation that we have to make sure that our end of the bargain is solid, it's rigorous, it's credible, and then take that out to combat what the other side is doing.
That creates our innovation as a cutting edge and rigorous methodology will help the people to trust the journal and the paper to replicate it further. So that's where I mostly my focus on what statistical techniques they are bringing, how the sample they made, how the answer to the questions are very clear.
We're going to also really try to focus on, well, what can we do about it? Absolutely. So not just what the problem is. And we're working to raise awareness, especially among younger generations of practitioners who maybe weren't around during the early years of, the tobacco trials and the settlement dollars. And so raising awareness, but then also really pushing for the adoption of a comprehensive framework for conflict of interest policies.
So this journal is really about leveraging that catalyst moment, making sure that we make a dedicated space in academia, in research for this type of research and specifically focus on it. And even though JMIR publishes a lot of epidemiology-related studies, having a home for it, I think, is very important. So really excited about the impact factor. The perfect home for this journal is at JMIR, and we're looking to expand this field.